So this video is the nerd version of why we have started to do something called Microneedle RF, or microneedle with radio frequency at Restore. The machine we have is called the Infini, so you can Google it and look at before and after pictures. It's really pretty cool. But the question is, why did we bring this machine on? Why is it different from other types of lasers and tools that we have? What makes it so special and effective? And that's what I'm going to talk about today. So the central problem that Microneedle RF, or the Infini, is designed to solve is how do you treat skin laxity? And laxity is the fact that our skin over the course of time starts to get a little bit stretchy and loose. And you see this in older folks where their skin just kind of is almost hanging like curtains on their arms or shoulders. Or when we start to, where our skin starts to just get stretched out and we get jowls and our necks just get all sort of stretchy underneath the eye. These are very common things that happen to all of us. Why does our skin get lax? Well, the answer is all the layers of our skin break down slowly over time, and as they break down they lose their cohesiveness, kind of like when you wear nylons for several times and they just lose their stretch. Same thing happens to our skin. The problem has always been, when trying to treat laxity, you have to be able to treat all the layers of the skin, and that can be very technically difficult. You know, this would be an epidermis, dermis, subcutaneous, muscular layer. The problem is, how do you take some kind of energy source here at the top, get energy all the way through to the muscular layer, because that's, you need it all the way through, without that energy then being hot enough to destroy the surface of the skin completely. This has been the technical problem with skin laxity ever since we started trying to treat it 20 years ago. There have been two solutions so far. One is, you burn off the top layers, which is what the big fractional lasers or CO2 lasers, things like that, they just completely vaporize this layer of the skin. That allows them to get heat down in here. They do a tremendous job of tightening. It works very, very well, but of course, a lot of pain. You are bleeding and oozing for approximately 7 to 10 days at home. You're red for a month. There's significant downtime that comes along with just destroying these layers. So it's a solution. It works, but it's not a perfect solution. The other solution is use a scalpel. You make a cut. You do what you got to do. You sew the cut up. That's what the surgeons do. Again, works very well. They have beautiful results. But of course, downtime, pain, infection risk, everything that goes along with surgery. So that's been our central problem. And Microneedle RF, or microneedling with radio frequency, essentially solves that problem. And it's very, very elegant the way it does it. So microneedling, you take a small needle, almost microscopic, very tiny needle, you set it to a certain depth. You do 3 passes, so you set 3 different depths with your needle. The needle is insulated along its body. So when you deliver heat just at the tip of the needle. And you can do different settings for each of the different layers of skin. So what you can do is, with only tiny, tiny microscopic wounds to the surface area of the skin, you can deliver all of this heat and all this energy specifically to all the other layers of skin as deep as you need to go. Thereby you get surgical grade tightening. It's really pretty fantastic. With only 1 or 2 days of redness and very, very little pain. So that is why Microneedle RF is such an exciting technology. We finally have a way that we can reliably tighten skin, non-surgically, with almost no downtime and essentially no risks. And so it's very, very exciting. So we are proud to offer microneedle with radio frequency, or Microneedle RF, at our practice.